Welcome back to my channel Medical Laboratory Technologies videos. Today friends, I am going to discuss you one of the important topic that is coming not only in exams but also in job in exams also. It is coming, sure there are MCQs that will come from arterial blood gas topic. So first we will discuss what is arterial blood gas test, why this test need, what is the purpose, what sample need, and what are the important components that are helpful to interpret the result. There are actually three steps to ABG interpretation, but first we have to understand the components, and before component first we have to understand what is an arterial blood gas test. An arterial blood gas test is a blood test that measures the acidity or alkalinity, or we can say easy words pH, and the level of oxygen and carbon dioxide gases from an artery. Means the measurement of arterial gases, that is ABG test. An ABG is a blood test that measures the pH, level of oxygen and carbon dioxide from an artery. But next point is that why we need this test, the purpose of this test. This test is used to check the function of patient's lungs and how well they are able to move oxygen into the blood and remove carbon dioxide, and also it will help to differentiate if patient is coming with the problem, then this test will help to differentiate between respiratory acidity or alkalosis or metabolic acidity or alkalosis, so we can easily differentiate between these. So this will check also acidity and alkalinity of arterial circulation and also measure gases, oxygen and carbon dioxide. But sample need for this test. An ABG test requires small volume of blood that be drawn from radial artery with a syringe and a thin needle, but sometimes femoral artery in the groin. Groin is the junction area between abdomen and thigh, or other site is used. And now blood can also be drawn if these syringe not available, then the blood can also be drawn from an arterial catheter. Now we will come to the main point of the topic, that what are the important components in ABG interpretation. There are four important components: pH, PaCO2 means carbon dioxide, bicarbonate, and PaO2 means oxygen. First, the important component is pH. pH, what will identify? We will identify acidity or alkalinity of blood. As you know, normal pH is 7.35 to 7.45. So we will see if less than 7.35 means blood will be acidic, if more than 7.45 means blood will be alkaline side. So first factor is the important one is pH. Next is carbon dioxide. Carbon dioxide measurement is controlled by lungs, means carbon dioxide is controlled by lungs, and normal value is 35 to 45. Here one easy point to remember the range of carbon dioxide you can remember by the pH value also. How you see the pH value is 7.35 and 7.45. if you remember the value next to point 35 to 45, that is same value, same normal range for carbon dioxide also. So now you can remember that carbon dioxide is value normal range is 35 to 45. Here one important point related to carbon dioxide that will help to understand the lecture later on, that carbon dioxide level is directly proportional to the hydrogen ions, means to the acidic nature of blood. If more hydrogen ions will produce, it means more carbon dioxide in blood and blood will be acidic. Or we can say that if more carbon dioxide will be produced in the blood, then more acidic blood will be. And if carbon dioxide is more than 45 means blood is acidic, and if carbon dioxide is less than 35 means blood is basic side. So carbon dioxide have direct relation with hydrogen ions, or you can say that carbon dioxide have direct relation with acidity of blood. If more carbon dioxide will produce, blood will be more acidic, and that point will help you in coming points also or later lecture also. Next important component is bicarbonate, HCO3. HCO3 we will call bicarbonate. Bicarbonate is controlled by kidneys and normal range is 22 to 26, and bicarbonate is directly related to basic nature of blood, or basic, or we can say that OH ions. If more bicarbonate ions will produce in blood, the pH of blood will be more alkaline, or we can say that more more bicarbonate in blood means blood is more basic side. If more than 26 bicarbonate ions, it means that blood is basic side, and if bicarbonate ion is less than 22, blood will be acidic side. So carbon dioxide and bicarbonate ion is controlled by kidneys, and kidneys and lungs, they are both work hand to hand to control the blood pH, that you will understand in the third step of interpretation, that how they will work hand to hand. Next is oxygen, fourth component in ABG interpretation, and oxygen is also controlled by lungs and normal range is 80 to 100, but oxygen will only determine the hypoxemia, not acidosis or alkalosis. Acidosis and alkalosis is related to pH, PaCO2 and HCO3. Now we will go to the important point, that ABG interpretation, that what are the three steps to interpret the ABG test or ABG results. Now we will start that topic. First step is to identify if it is acidosis or alkalosis. For that step, what have we will see? We will see the pH of blood. I write all normal ranges at the side of the whiteboard. You can see there. pH normal range is 7.35 to 45. Now, how we will identify that if it is acidosis or alkalosis? We will see the range of pH, we will see the value of pH. If value is coming less than 7.35, it means acidosis. For example, patient result came 7.25, pH showing 7.25, it means acidosis. Next is, if greater than 7.45, it means alkalosis. For example, if value came 7.55, it means alkalosis. So first interpretation is to identify acidosis or alkalosis, and that is related to pH. Normal range is 7.35 to 7.45, and if it is less than 7.35, it means acidosis, and if it is greater than 7.45, it means alkalosis. Now second step of interpretation, that is more important, and always you will feel confused also, so this will not confuse you, that metabolic or respiratory. So to identify that problem is respiratory or metabolic, we need two important components that I discussed before, that is carbon dioxide and bicarbonate ions. As I told, that carbon dioxide is regulated by lungs. So if there is abnormality with carbon dioxide, it means that it is respiratory condition. Means if you will see in results that carbon dioxide levels are abnormal but bicarbonate levels are normal, it means it is respiratory condition. And next is bicarbonate ions. As I told, that bicarbonate ions, their nature is basic, means they are regulated by kidney. So if there is abnormality with bicarbonate levels but carbon dioxide levels are normal, it means it is metabolic conditions. So carbon dioxide abnormality is related to respiratory, and bicarbonate ions, as they are regulated by kidneys, so their abnormality is related with metabolic condition. Now I will share you 4 examples. From that 4 examples, your all confusion will be clear. First example is pH. You see pH is given 7.25. As you can see that pH is less than normal range, so it is acidosis, or we can say that acidic. And next is PaCO2, patient value carbon dioxide is 50, that is high because normal range was 35 to 45. So if pH is low, acidosis and carbon dioxide is high, it means respiratory acidosis, because if you will see the bicarbonate ions are normal. So first example is showing what? First example is showing respiratory acidosis. In your exams or in your MCQs, this question will come also like that, that pH is low, carbon dioxide is high and bicarbonate levels are normal. Then what will be the diagnosis? So if you will keep these concepts in your mind, then easily you can identify that pH is acidic and carbon dioxide levels are high, it means respiratory acidosis. And as I discussed before, that if carbon dioxide level will be increase in blood, sure pH will decrease, or sure pH will, there will be more acid in the blood, so sure pH will be acidic. So now you can see this example also, that it is clearly showing respiratory acidosis. Now we will move to the next example. If you will remember the relation of pH, carbon dioxide and bicarbonate in your mind, then it will be very easy to identify MCQs or question any type. Now you see the second example. pH is 7.56, it means pH is high, and PaCO2 means carbon dioxide is 28, that is low because normal range starting from 35, but bicarbonate ions are normal 22. So as I told before, if there is abnormality with carbon dioxide, then the condition will be respiratory, but this time it is respiratory alkalosis because pH is high. And as we discussed before also, that if carbon dioxide will be decrease in the blood, pH will be basic, or blood will be more basic side. So this is respiratory alkalosis. And why respiratory alkalosis? Because bicarbonate levels are normal and carbon dioxide is low and pH is high. Now we will move to third example. In third example, we will see the pH is 7.25 and pH is again low side, and carbon dioxide is 37, that is normal, and bicarbonate are 19, that are also low side. So here we can see that bicarbonate levels are abnormal and carbon dioxide level are normal. So this is metabolic condition, and according to pH it is metabolic acidosis. So as I told that when bicarbonate level will decrease, pH will be blood will be more acidic side. So here we can see that also, that bicarbonate is 19 and pH is 7.25, so it is metabolic acidosis. Now we will go to the fourth example. pH is 7.58, that is higher than normal, means alkaline or alkalosis, and carbon dioxide is 40, that is normal, and bicarbonate levels are 35, that are high, more than 26, so it is metabolic condition, and according to pH it is metabolic alkalosis. Now your concept will be clear about respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. In simple words, you can I will give you one more idea to remember these. If you will notice in these examples also, if pH is low, bicarbonate level will be low. If pH will be high, bicarbonate level will be high. But if pH is low, carbon dioxide level will be high, and if pH will be high, carbon dioxide level will be low. So you have two options to keep in your mind. Either you can keep in your mind the relationship with the pH, carbon dioxide and bicarbonate ion, or otherwise you can keep as this also in your mind. Then it will be easy to identify the problem. As easy for you, you can choose that option to keep the concept in your mind. To remember respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. Now the third important step is to identify if it is partially compensated or fully compensated. Partially compensated and fully compensated means what? As I told in the start of lecture, that lungs and kidneys are working hand to hand to maintain the pH of the blood. So if patient is coming with respiratory issue, that time bicarbonate level will be either become low or high according to the respiratory condition, respiratory acidosis or alkalosis, and bicarbonate level will try to maintain the pH of blood or neutralize the pH of blood according to the condition. And if patient is coming with metabolic problem, acidosis or alkalosis, that time carbon dioxide level will play important role to maintain the acidosis or alkalosis of that condition of patient. For example, if patient is coming with respiratory acidosis, as we learn in just example before, respiratory acidosis, that pH is decreasing and carbon dioxide level will be high. So when carbon dioxide level will be high, there will be more acidic in the blood. That time bicarbonate level will be increase in blood to neutralize the acidity. That time means bicarbonate level will compensate to maintain the pH of blood. And if it is respiratory alkalosis, that time bicarbonate level will produce less, so that to decrease the basic side of blood and to maintain the pH, and that time also bicarbonate ions will be compensating. In metabolic acidosis and alkalosis, carbon dioxide will compensate the pH of blood. For example, if metabolic acidosis, then carbon dioxide will produce less, so that if blood will not be more go to acidic side. To neutralize the acidity, carbon dioxide level will decrease and carbon dioxide will compensate the condition. And if metabolic alkalosis, then carbon dioxide will produce more, so that basic side of blood will decrease, and to maintain the pH, and carbon dioxide will compensate. So this is the compensation concept. Now what is partial compensation and what is full compensation? Now I will tell you. Partial compensation means bicarbonate ions will compensate, but in result we will see that pH is still either will be low or high. And in full compensation we will see pH will become normal, and we will see that either carbon dioxide or bicarbonate ion will compensate. Now from examples I will show you, then your concept will be more clear. Now you will see the partial compensation. First example, pH is 7.30, it means pH is acidic, and that it means acidosis, and carbon dioxide level is 50, means in result you are watching the result. Then how you will identify that this is partial compensation? First you will notice pH, it is normal or low or high. In this result we will see the pH is low, 7.30, it means acidosis. And if pH is low, sure carbon dioxide level will be high. So carbon dioxide level is 50, it means that is respiratory acidosis. And bicarbonate level also we will see not normal, that are increased. So it means bicarbonate levels are now compensating the respiratory acidosis. So this is partial compensation, because in partial compensation we saw pH is still not normal. Then second example, if you will see pH is high, 7.50. If pH is high, it means that bicarbonate levels also will be high, and carbon dioxide levels should be either normal. But here we will see pH is 7.50, it means alkalosis, and bicarbonate level is 41, it means condition is metabolic. And carbon dioxide level also we saw that increase to compensate the basic side of blood. So carbon dioxide level is playing as a compensation role. So this is also metabolic alkalosis with partial compensation. Now your concept clear that in partial compensation we saw that pH is not normal, and in respiratory acidosis we saw bicarbonate ions are compensating, and in metabolic alkalosis we saw carbon dioxide is compensating. Now in full compensation, what question will come in mind, that if pH is also normal, then how we will identify that this is metabolic acidosis or respiratory acidosis from two values, or how we will identify that which is compensating to each other. First option is, first know your patient diagnosis. If patient is coming with respiratory problem, and if it is respiratory, then body will compensate by bicarbonate ions. And if patient coming with diarrhea, vomiting, it means patient is coming with metabolic problem, and body will compensate by carbon dioxide. Now in first example we saw pH is 7.35, that is normal. But now you have to focus on the value of pH, that pH is normal, but which side normal, acidic side normal or basic side normal. 7.35 is exact starting range of pH, so 7.35 means normal, but it is acidic side normal. And carbon dioxide level is 49, that is high, and bicarbonate level are 30, that also high. So it means this is respiratory acidosis. And because bicarbonate ions are compensating, and this is full compensation because we saw pH is 7.35 within range, it's normal. So this is first example. Now we will go to the second examples, but before second example again I will tell you, if you don't know the diagnosis, then check patient pH value which side. Low side P means acidic side, and normal compensation is full compensation. And if pH is basic side but normal, it means that compensation is also full compensation. As first example I showed you before also, pH 7.35 normal but acidic side normal, and carbon dioxide is 49, it means carbon dioxide also high, and HCO3 is 30, that also high. It means respiratory acidosis but full compensation with bicarbonate ions because pH is normal range but acidic side normal. Next result, if you will see, the pH is 7.44. If you will see, normal range of pH is 7.35 to 7.45. So 7.44 also means that it is basic side normal. In first example again I will tell you, if 7.35, 7.34, it means that is acidic side normal, and 7.44, 7.43, that means basic side normal. So pH is 7.44, it means alkalosis. And if 7.44 pH, it means that bicarbonate level will be high. So this is condition is metabolic, and compensation is by carbon dioxide, and that compensation is full compensation because pH is normal range, and but normal range is alkaline side. So it will be helpful to identify that this is metabolic alkalosis condition, was patient condition was metabolic alkalosis, and that compensation is by carbon dioxide. So this was the lecture about ABG interpretation, how we will interpret. And now you identify that what are the components that are helpful to identify the result of patient. And I hope you understand the concept also, that how to identify respiratory acidosis or alkalosis or metabolic acidosis or metabolic alkalosis, because this topic is very important in this topic. And always from this topic MCQs will come, 2-3 MCQs must coming in your international exams like Prometric, DHA or HAD, that type of exams. Sure question is coming from this topic. I hope this topic will help you in future also. Thank you so much. Thank you for your support. We will meet with you. I will meet with you new topic. Until that, take care of yourself.